Here's today's 5-minute medical update. So for part 2 of our series, What's Up with the Mask, Doc?, let's specifically deal with the studies regarding the use of masks. Know that up to a fourth of cases of SARS were in healthcare workers in some locations worldwide in 2003 to 2005. And the initial studies thought that the primary way of spreading this was through large droplets, and that was still the case up until March of 2020 regarding coronavirus. But then it was found in the studies that you see me filing through to the right that there were aerosols that were being detected in hospitals especially, much more so than in public settings, that have become a much more important factor in our concern about spreading coronavirus, COVID-19, or SARS-CoV-2 it's called. So for the SARS virus in 2003, 2005, and 2012, so up until March of 2020, with SARS research before the coronavirus pandemic hit, it was felt still that most of the widespread respiratory viruses were transmitted primarily through large droplet direct contact. But studies early in March of 2020 began to suggest that both in the inpatient hospital and public settings that aerosols became a much more importantly debated possible cause. And the research from SARS showed that in fact aerosols were a significant cause and of course a much more dangerous cause since they can affect people at a distance. The studies revealed that the transmission of SARS occurred both in the direct short-range droplet transmission via direct contact and direct secretions, as well as the at-distance indirect airborne transmission via the transport of droplet nuclei in ventilation systems and in general floating through the air further away from the original source. So many natural human activities in these studies show that there's a potential to disseminate infectious aerosols from breathing, talking, coughing, sneezing, and even singing, which may be a particularly effective means of transmitting airborne infections, according to Cole and Cook in 1998 and Wong and Lung in 2004. Now, one of the things that was discovered early on in the COVID-19 pandemic was that this virus is not spread through breastfeeding or vertically in the birth canal. It is, however, found in stools, and so the fecal-oral route with poor hand-washing techniques, such as was present with typhus, typhoid Mary many know about. This is one way, but it's a very minor source, and we've not had a significant health problem because of this. So those are just some baseline facts that you need to know before looking at these interesting findings that have been discovered through studies. One is that coughs and sneezes are similar in speed and velocity in ejecting particles to one another. It's been said in the past, and I've even quoted this, that people sneeze at 200 miles an hour. This is simply not true. These propellants come out at about 37 miles per hour, and there's not a significant difference in sneezing and coughing from the study above. There was a study about attempts at household control using masks, and what was found in Australia was that people simply will not wear masks enough in the home to decrease the significance unless there is a very severe risk or a perceived very severe risk in household transmission, such as was present in SARS or the Ebola crisis. Now, a Schlieren optical study, very interesting data, a very unique way to look at exhaled and aerosolized particles, showed that various infectious agents are known to be transmitted naturally via respiratory aerosols produced by infected patients. And they can be produced during normal activities like breathing, talking, coughing, and of course sneezing. So direct experimentation in computer simulations showed in studies that an N95 face mask should reduce the risk for airborne transmission of influenza viruses by aerosols containing the very tiny droplet nuclei in both aircraft cabins, in close train travel, by up to 90%. Less efficient face masks, such as surgical or medical masks, such as similar one to what you see here, and this looks like an N95, but it's not. These medical and surgical masks that are synthetic, so many that you see even in our clinics, are still very good at protecting against the larger droplets. There was a study called Particle Size and Pathogenicity in the Respiratory Tract by Richard James in the journal Virulence. This was fascinating because he showed that all the mechanisms of human oral nasal activity, such as breathing, talking, laughing, coughing, and sneezing, produce particles all within the inhalable range from less than 1 micrometer to greater than 1 micrometer, and that these small particles of 1 to 3 micrometers, or 1,000 to 3,000 nanometers or nanometers, diffuse into deep lung tissue, deposit in the alveoli by a number of mechanisms, including diffusion, sedimentation, and even electrostatic effects. So basically what this suggests is that these aerosols can get deeper into the lung and cause some of these more devastating infections in the alveoli deep within the lung. And as one pulmonologist told me this week, that by the time a person who has that type of infection needs to be placed on an intubation ventilator, it's often 80+% of the time too late, and they are going to die regardless, which is tragic, and it's one more reason that we want to protect against these aerosolized droplet nuclei from infected patients. So the site of deposition after an inhalation event can affect the disease kinetics, the author said, as well as the pathogenesis. The airborne lifetime of small speech droplets and their potential importance in SARS-CoV-2 transmission was a fascinating video study done by Valentin Stadyaniskia from the National Institutes of Health. This was published recently, and this video clip that I'm narrating shows that the large droplets and small droplets with 1.5 hours of laser scanning of a space that a speaker simply for about 1 minute spoke into, these droplets, the smallest droplets, the droplet nuclei, circulated in that space for up to 80 minutes. And again, it stated that even though it's not widely known, now you know that even speaking produces all the various types of these small and large droplets that circulate in the air, that land on surfaces, and that even 1 minute of speaking loudly generates at least 1,000 virion-containing droplet nuclei that remain airborne for between 8 and 80 minutes. One minor note, but very interesting, is Cohen Cook in 1998 did a study that they called the characterization of infectious aerosols in healthcare facilities. And they studied also orthopedists in particular, and somehow in this study, because I could not get the PDF, they found that singing alone was a very efficient way to aerosolize respiratory viruses, and this is going to be studied some more in the near future. A study in early May of 2020 in Singapore showed that, as with many other aspects of health behaviors, that it is what the patient believes that counts. The people in Singapore were found to only use masks regularly if they felt that they were at significant risk for coronavirus, and if they did not feel like they were, they would not wear masks routinely. This study did show, however, that surgical and medical masks, not even respirators, N95 masks, for example, are effective in preventing the spread from breathing, coughing, or sneezing, or being coughed, sneezed, or breathed upon. However, that compliance was low as stated above. Another study called a cluster of randomized trial of cloth masks compared with medical masks in healthcare workers by McIntyre et al. In the Open British Medical Journal shows the one major controversial finding that is going to disturb many in what I'm going to share with you tonight. That is that cloth masks may increase the risk for respiratory viral illnesses from 150% up to 1,300% in a randomized study, and that cloth masks were found to be, in one study, 400% worse than wearing no mask at all. It was allowed by the authors that this could be due to the handling, the properties of construction, the methods used to care for the masks, but in no study that I found could I confirm any positive association with actual prevention of an upper respiratory virus in a person who wore a cloth mask. So the findings that should change behavior. What do you do with all this? Remember that surgical or medical masks offer significant protection even from aerosols if worn appropriately and continuously in risk environments. That N95 masks must be worn, that is respirator masks, must be worn in enclosed healthcare spaces where there are active cases of coronavirus because of the aerosol producing procedures and the aerosols that come from coughing and sneezing in ill patients. The results show that human coughing projects a rapid turbulent jet into the surrounding air, but that wearing an N95 mask thwarts both the spread from an infected person to others or from others who are infected to oneself. All the jets and eddies can be seen in these pictures that I'm going to put up. It was fascinating to look at some of these studies. But just understand that masks do work if used correctly. Their clinical trials showed that wearing a mask significantly reduced the potential to both spread the influenza virus, coronavirus, rhinovirus. This same study showed that the way that these respirator or even surgical masks work, and they were both significant, is that the mask redirects the turbulent jet force that comes out of a sneeze or a cough outward away from a person, and that the large droplets are trapped. And this suppresses this more infectious material from directly in front of someone to the sides. The surgical masks, however, have not been shown to be any less effective in N95 respirators in one study in a single COVID case in Singapore with more than 30 healthcare workers exposed. Also, it was found in the studies that respiratory viruses are spread via aerosols as much or more than direct contact or droplet expulsion. What do we do about all this? Just some basic common sense things that you might take from all these studies and my synthesis of them. Number one, wash your hands thoroughly and often. Number two, if you're in an area with those who are coughing or sneezing, wear a mask. If you're in close contact, that is less than 6 feet, especially for over 5 minutes, with someone conversing who might be ill, and there's a possibility that there are others that are infected, wear a surgical mask or a medical mask. If you wear a cloth mask, you must not touch them, you must assure that they don't get wet, you must change them frequently, and wash them effectively after every wearing with a bleach solution in a washing machine according to the CDC. I must say again, cloth masks, according to the studies that I've seen, are found to be pretty much worthless, except as an obligation to keep from getting yelled at in a Walmart aisle. Finally, if you want to wear a cloth, surgical, medical, N95 respirator, or gas mask for that matter, it's free country. Knock yourself out. I don't think you're going to cause a problem by wearing a mask. However, if you're not coughing or sneezing or running fever, you aren't in a hospital or around the vulnerable, you haven't been around anyone with COVID-19, and you don't want to wear a mask because as an adult in a free country, you don't have to, then don't. If someone confronts you, say that you've reviewed the data from a board-certified physician who has gone over every relevant study in the last 33 years, and that you've made an informed decision to not wear a mask. Remind them that there is no law stating that they have to come within 6 feet of you. Also, there's no need to wear a mask in your own home or auto if there's no one sick with you. Remember that there is no need to wear a mask if you're exercising outdoors or you're not going to be within 6 feet of someone for significant amounts of time, especially just in passing, running, walking, jogging. Even if someone is at risk who may be ill, the risk is nearly zero from just a bypass, so be reassured about your exercise and outdoor activities. Now, we're assuming, and I'm going to just make the common sense assessment, that you're out looking out on the horizon for people who are hacking up a lung, sweating profusely, or sneezing their heads off. If you're going to wear a mask, do it right, or you're just wasting your time, effort, and money. Remember, it's always better to be safe than sorry, and it might just be easier to be a good example to people and avoid offending them by wearing a medical or surgical mask. I say again, the best studies don't support wearing cloth masks at all and suggest that they may actually increase the wearer's chances of getting a viral upper respiratory infection, including coronavirus. Now that's my story after about 16 hours of labor in a sincere attempt to encourage and bless you, and I'm going to stick with that story. I'll see you with a new update in a few days, and maybe not even about coronavirus. I really do appreciate your time and attention, and I hope this helps you.